Hello, everyone. Thank you so much for taking time out of your day to join us for today's Needy Med special topic webinar presented by our partner, the Lupus Foundation of America. Make the most of your medical appointments. My name is Carla, and I am the Director of Education Initiatives with Needy Meds. And before we get into today's presentation, I'm going to offer a few tips so you can make the most out of it. First of all, you can ask questions at any time, and we encourage you to do so by typing them into the chat section of your Zoom control panel. Just know we do keep the question segment brief, so if we don't get the chance to answer your question, we or our staff will be following up with you via email. But of course, we will provide the contact information for both the Lupus Foundation of America and Needy Meds at the end as well. I'm happy to report that, like all of our other webinars, videos, and presentations, today's special topic webinar will be converted into a video and uploaded onto the Needy Meds YouTube channel. And I hope you guys check it out and subscribe because it's a great way not to miss any webinars you're interested in. So I'd like to get started just refreshing with the audience today what is Needy Meds exactly. For those of you not yet familiar with us, what you're looking at on your screen is our mission statement. But simply put, Needy Meds connects people with programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our toll-free helpline, 1-800-503-6897. So as you saw a couple of slides ago, a big part of our mission is also education. And we define that really in two ways: by educating people about Needy Meds, but also by letting them know about other ways to stay healthy, which is why we are so pleased to have our guest, Ashley Holden from the Lupus Foundation of America, here with us today. And before I pass the mic and the screen to Ashley and introduce her, I want to share a little bit about what our partner, the Lupus Foundation of America, is all about. They are devoted to putting an end to lupus, a chronic and potentially fatal autoimmune disease, while giving caring support to those who suffer from its brutal impact. They work to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. The Lupus Foundation has made pioneering contributions towards ending the brutal impact of lupus. Their efforts have stimulated advances in lupus research that are providing insight into the underlying causes of lupus and its progression, while creating unprecedented opportunities to expand the future knowledge base for lupus. So now let me tell you a little bit about our guest, my friend Ashley Holden. She is a health education manager at the Lupus Foundation of America's national office. Ashley is a nationally certified health education specialist from the National Commission for Health Education Credentialing. She also has a Bachelor of Science degree in public and community health, a Master's of Education in Health Education, and over a decade of experience working in community health and the health insurance industry combined. So you can see why we keep asking her to come back and present important topics to our Needy Meds audience, because she really has an unparalleled level of experience. So the reason Ashley is with us today is to talk about how to make the most of our upcoming medical appointments. Now, we all know that going to the doctor can be stressful, especially if you're dealing with new symptoms or if you're having difficulty getting answers. And unfortunately, that's something a lot of us can relate to. So today, Ashley is going to walk us through how we can all make the most of our upcoming medical appointments, and she'll share tips about how we can prepare ahead of time. And that's really important, because the more prepared you are, the more likely you will actually be to discuss the issues that are most important to you and to leave with a plan in place. So, without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Ashley. And as we do that, I want to remind everybody that you can submit questions again by typing them into the chat section of your Zoom control panel. And as I said, we'll get to as many as we can, but if we don't get a chance to answer yours, don't worry, we'll follow up with you and provide our contact information at the end. So without further ado, and Ashley, I can see your PowerPoint perfectly, so I'm going to go ahead and pass the mic to you. Enjoy the presentation, everybody, and thanks for joining us.
Great. Thank you so much. And thank you so much for having me today. I'm so excited to give this presentation. As Carla mentioned, my name is Ashley, and I'm a health education manager at the Lupus Foundation of America. And today I'll be speaking about tips for making the most of your medical appointments. Bear with me, I'm working with two screens here, so hopefully I can get these slides to change. So
Perfect.
Perfect. Before we jump right into today's topic, I did want to talk just a little bit more about the Lupus Foundation of America and some of the resources we have available. So first, just kind of a review of our vision and our mission statement. So we really want to have the population have a life free from lupus. And our mission is we're dedicated to improving the quality of life for all people affected by lupus through a variety of different programs. But to put this simply, our goal is to one day end the impact of lupus and its suffering while ensuring that we provide the comprehensive support and programs people with lupus need today. And, the Lupus Foundation of America works to meet the diverse needs of all people with lupus. Our commitment has never wavered in our more than 40 years of service. I'm also pleased to share that today, people with lupus are living longer, healthier lives than ever before. And at the Lupus Foundation of America, we've played a significant role in that achievement. We remain resolved to doing everything we can to help those with lupus navigate the complexities of the disease while rallying every possible resource to end it forever. We operate among three different pillars for our programs, and those include research, our care and support for people affected by lupus, and advocacy. We have redefined lupus research, and we've expanded our efforts beyond just funding research grants. We engage all stakeholders to identify different barriers that stand in the way of progress and are setting a course to overcome them. And we do this while providing care and support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. So we have a host of different resources available, but in the interest of time, I will keep this brief. And I just wanted to hit a little bit more in detail for a couple of these. And so the first one that we have available is our National Resource Center on Lupus, or the NRCL for short. And that's kind of a one-stop shop, or a living library, if you will, for resources that are all things lupus. We cover things from treatment to living and coping with the disease. And it really aims to ensure that anyone affected by lupus, including those that might be diagnosed, caregivers, healthcare professionals, or even those that think they may have lupus, have access to high quality resources that provide emotional support, clear and accurate health information. We know how difficult it is to make sure that you're finding the best information out on the internet. There's so much available out there, but it's not all good quality or high quality. I also want to mention our certified health education specialists that we have at the Lupus Foundation of America. And these are real people that are available to answer questions either by email or phone. And they are trained to provide people with lupus, family members, caregivers with non-medical counseling, disease education, and helpful resources. Our health educators can help anyone that has questions about lupus find trustworthy information to answer those questions, can help with providing information on how to cope with the disease. And again, if you're interested in that, you can visit our website, lupus.org/health educator, in order to contact us. We also, and this is really important here, and I want to mention this, we have 2 health educators that are bilingual that speak Spanish. So we are able to provide answers in Spanish, and the same with our NRCL that I mentioned. We do have Spanish resources as available as well. A couple of other resources really quick in terms of self-management. We also have Take Charge, and this is an education email series that is focused on providing tips and resources that can empower people to take charge of their health in terms of lupus. And it covers different topics like identifying and tracking symptoms, sticking with a treatment plan, and just like today's topic, it also gives tips about getting the most out of your doctor's appointments, among other topics. I'm also really excited to share that we have Self, and this is another self-management tool that we have. This is Self stands for Strategies to Embrace Living with Lupus Fearlessly, and this is an online free program, and it can be a virtual coach for someone that has lupus. And it has a lot of really key features that are important for someone that has lupus, such as a symptom tracker, a medication tracker, a journal to help you record how you're feeling, and more. And the self-management program it is focused on 4 different areas that include managing symptoms, managing stress, managing medications, and working with your healthcare team. So all really great ways to improve your care and manage your disease better. We also have a variety of support groups available. Many of them are meeting virtually, so visiting our website is a great place to get more information about these support groups. We also have local chapters and regions as well. And so again, visiting our website or lupus.org/chapters is a great way to find out what events may be going on in your local area. And then finally, there's a variety of different ways that you can get involved and support the fight to end lupus. We have our walks. We have ways that you can advocate with us. You can start your own fundraisers, raising awareness. We know that not a lot of people know what lupus is, or they may know the word, but they don't know a lot of details about it. So if you're not familiar, Lupus Awareness Month is in May, and we put out a lot of great resources around then that can be shared. So again, we have a lot of different ways to get involved if that's something you're interested in. But in the essence of time, we're going to, like I said, jump into really today's topic. That is how you can prepare for your appointment so that you can get the most out of that time with your care provider. And we're going to focus on 5 main areas when it comes to preparing for an appointment. And these include managing expectations, getting organized, being proactive, communication, which is always key in most of things in life, right? And your follow-up. So first we have manage expectations. And, perhaps you were recently diagnosed by your primary care provider with some type of chronic disease, and they've referred you to a specialist. It's important to see that specialist in a timely manner, but when you call, you're shocked to learn that you must wait weeks before you can get in to see that doctor. What are you to do in the meantime? And even if you're not diagnosed with something, we find that, sometimes there are lengthy wait times before you can see a doctor, especially as a new patient. So your first opportunity for a good visit to the doctor comes when you schedule that appointment. It's important to be understanding when scheduling your appointment. Like I said, it may take a few weeks to get an appointment. The staff understands it's important for you to see the doctor and will help you get scheduled as soon as possible. To put appointment wait times of weeks or even months in perspective, there's a projected shortage of 2,500 rheumatologists in the very near future. And that number is expected to grow. And in fact, it may have grown since the last time I looked that number up, but we are facing a shortage of different specialists. And because we don't have as many, it's taking longer for patients to get in to see those providers. It's also important to take time to talk with the staff about the visit you're scheduling so they can make sure they schedule enough time and can take care of your concerns during the visit. If you have urgent concerns, you should let the staff know. They may be able to work you into the schedule. If they work you in, though, be prepared to wait a little longer in the wait room since they're squeezing you in. Keep in mind that you may need multiple appointments if you have a long list of concerns or if your doctor is working to give you a diagnosis. And when you can, try to make your appointments at least a couple of weeks in advance or even longer if it's your first visit with a new doctor. So that'll give you time to prepare for your appointment and allow time for your medical records to be transferred from other care providers. As I mentioned, you may need multiple appointments if you have the long list of concerns or if they're working to give you that diagnosis. Also, try to use a calendar. I know that we live in the age of technology. I'm sure there are apps you can use the calendar on your phone, but you can use those to keep track of your appointments. You can also put all of your doctors in your contact list, include their name, specialty, and address. And that way you'll be able to access their information no matter where you are from your cell phone. You can also ask your doctor's office or health insurance provider if they have social workers or care providers, care coordinators that can help arrange and organize specialist appointments and help you prepare for follow-up appointments or future consultations. Not everywhere has a social worker or a care coordinator available, but it's worth asking, especially if you have a lot of conditions or you have a lot of appointments that need coordinating or you need help with. So I mentioned this briefly about kind of scheduling in advance so you have time to get everything together. But your next step would really be to kind of get organized and start pulling everything together in advance of your appointment. So first, you'll want to organize your medical history. So the greatest part of your doctor's understanding of what's happening in your body will be based on your description of your symptoms, both now and in the past. So while the doctor also needs to examine you and look at the results of laboratory tests or imaging tests, your personal history gives valuable information. The more organized your medical history is, the easier it will be for your doctor to begin to consider possible reasons for your health complications. You can keep a binder or a folder with copies of your medical records or summaries that you receive. The binder will keep you organized and keep all of your important papers in one place. And that way you won't have to hunt down that information before an upcoming appointment. Like I said, you can keep copies of your visit summaries, your list of current doctors, and even list of current medications in that binder as well. Something else to consider putting in that binder, anytime you've had any kind of diagnostic test and the date. A lot of times medical forms asked if you've had, for example, a mammogram or a colonoscopy and the date of those. So you can keep a running list in that binder, and the same with surgery. So if you've had any surgeries, sometimes you have to think back maybe 10, 15 years and you start to question that date. It's nice to have it all in one place so that you don't have to really kind of boggle your mind to pull that date and make sure that you have it correct. You also want to make sure that you're tracking your symptoms. Like I said, you can keep a journal of your symptoms. You can use your phone. I know there's different apps out there. It just kind of depends what works best for you. But be sure to include a timeline and descriptions of your symptoms. Also, make sure you track symptoms that may have disappeared. We do have a checklist available on our National Resource Center on lupus that I mentioned that can help you keep track. They are lupus specific, but you'll notice that we have a lupus symptom tracker and also an impact tracker, right? So not just the symptoms, but how are they impacting your life? Because we know that that's really, a big part of those symptoms is, not being able to live a quality life or impacting doing normal things. I also mentioned in your binder keeping a list of your updated medications. But your doctor really needs to know what medications you're taking, including those prescribed by other doctors. You should also include any dietary supplements, or over-the-counter medications. So if you take, ibuprofen every day, or if you take it frequently enough, what about your vitamins or minerals or any herbs? Those are all things that you should keep track of. You can create that list, or you can bring all of your medications in their bottles, both prescription and non-prescription, like I said, in their original containers. And that way the doctor understands the dosage you're taking, how often you're taking it, and the refill schedule. Also, if you have a prescribed medication or dietary supplement that you're not taking for some reason, so it could be side effects, the cost, or for some other reason, tell the doctor that too. Any side effects you've noticed after taking a medication should be reported. It's important to tell your doctor that because they may be able to help you mitigate or lessen those symptoms, or find a medication that may cost less or has resources available to help you afford that. You also want to create a list of questions or concerns. So I know a lot of times we have them floating around in our head, but we get in front of the doctor and sometimes we forget them, right? So make a list. Like I said, it can be paper. You can make a paper list, or again, you can use your cell phone. Depends how dependent upon or how much you like using your phone, to make a list of topics and questions you want to discuss with your physician. It's really important to prioritize the topics and questions that you feel are most important for your doctor to hear about. This way, if you don't get through the whole list, you'll still have the most important questions and concerns addressed by the physician or the care provider. Also, thinking about what might the doctor ask you, right? So we want to anticipate what the doctor will ask. And a lot of times these questions apply mostly to symptoms. So if we think about how we would answer them ahead of time, it may help you to be able to perhaps provide a clearer picture for your doctor and really be able to remember everything. And these are just some sample questions. But like I said, a lot of them really do revolve around symptoms. When did the symptoms start? Does anything trigger it? Or does the symptom happen every day? Does it interfere with your daily routine? And if that symptom is causing pain. And so you can see why those trackers I mentioned earlier are so important, because that really would help you keep a log or diary of everything that's going on so you can recall it easier when you're speaking with your care provider. It's also really important to be proactive prior to your appointment. And you might be wondering, what does this mean? And so my first recommendation would be to understand your disease or condition, or if you're not diagnosed yet, maybe understanding what they suspect it is. And so understanding what exactly that is, what are the symptoms, how is it diagnosed, and even what type of doctor treats that disease or condition. They're all important questions that you should be asking. And so if you have that information about that disease or suspected condition, you're going to be better prepared for that appointment. Learning as much as you can before an appointment can help you recognize different terms or tests that the doctor may mention, or ease anxiety about the diagnosis process. Different types of doctors or specialists can include rheumatologists, dermatologists, cardiologists, nephrologists, gastroenterologists, pulmonologists, just to name a few. And this can be really overwhelming. And I do understand that. And we do have to be kind of careful with when we go out to the internet and what we find. But if we have a pretty good idea of what's going on, it's pretty safe to go to reputable resources and learn about that condition. So we can use lupus as an example of how we can be informed about a disease. So lupus, the awareness of lupus is fairly low. And so if someone were being diagnosed about this, they might not know a whole lot about the disease. So in this case, lupus is a chronic, long-lasting autoimmune disease, and it's different for each person or heterogeneous. Symptoms typically come and go, which makes it a pretty unpredictable disease. It's also, if someone is thinking they might have lupus, they might be concerned it's related to cancer or contagious. So by learning about lupus, we realize kind of what the disease is and what it is not, which hopefully can ease some worries that someone may have. You also should be familiar with who gets lupus or who gets the disease that you may be getting. In the case of lupus, we know at the Lupus Foundation of America, we estimate that 1.5 million Americans have lupus, and that there worldwide, at least 5 million people around the world have the disease. We think that there are about 16,000 new cases per year. You also might want to know if the disease disproportionately affects someone. So, while lupus doesn't discriminate, it can affect men, women, children, and people of all ages. We do know that women are more likely to develop lupus. In fact, 90% of people with lupus are women. Lupus is most often diagnosed between the ages of 15 to 44, but it can be diagnosed during childhood or in an older age as well. And so you can see that, understanding if you might be more at risk for a disease can be helpful as you go through this process as well. And in the case of lupus, lupus has a lot of different signs and symptoms because it can affect so many different parts of the body. And, most common signs and symptoms include extreme fatigue or fatigue that will not go away, regardless of how much rest a person gets. And as I mentioned, there's a wide range here. And so this is why it's really important to use a symptom tracker so you can make sure you're tracking what's going on. But also by being proactive ahead of time, you may realize that you're experiencing symptoms of something that you didn't think twice about. You probably wouldn't have tracked if you didn't realize it could be related to that disease or something else. Unfortunately, in the case of lupus, a lot of these symptoms can be caused by a host of other autoimmune diseases. And then, as I mentioned, you may want to be familiar with how your disease is diagnosed. So, in lupus, there's no single diagnostic test for lupus, making a lupus diagnosis kind of like putting together a puzzle. The doctor will look at several different puzzle pieces that include past and present symptoms, medical history, family history, lab tests, or tissue biopsies if needed. And if enough of the pieces fit together, someone could be diagnosed with lupus based on all of those pieces. But depending on what's going on, it may take some time for that doctor to put all those pieces together. And like I said, in the case of lupus, it helps to know that there's not a single test to diagnose lupus and that it may take some time to get a diagnosis. As someone that's familiar with that, it might ease some of those questions that you have as to why you haven't received a diagnosis right away or why someone needs to be sent for so many different lab tests. So lupus is a disease that's known for being difficult to diagnose because the symptoms are different from person to person. They come and go, and like I mentioned, they mimic the symptoms of many other diseases like rheumatoid arthritis, blood disorders, fibromyalgia, thyroid problems, Lyme disease, and a number of heart, lung, muscle, and bone diseases. So it really can sometimes take several years for a person to receive an official diagnosis. We found on average it takes about 6 years for someone to get a lupus diagnosis. And again, that diagnosis process can be complex, and being familiar with the disease, even if it's not lupus, I know we're using lupus as an example here, but it can help to ease your anxieties and help the process as you're going through that diagnosis process or whatever that may be with your doctor, just knowing more about what you're facing. You may also want to research about possible treatments so that you can have questions prepared ahead of time about that medication or why one medication is selected versus another one. So communication is key, and communication is key, I think, in any part of life, not just doctor's appointments. So, let's talk about communicating during your visit. So you want to remember to bring your medical history, prescription history, symptom tracker, and a list of questions that you worked so hard to prepare before your appointment. All of this information will give your doctor a clearer picture of what's happening with you. It's nice now, sometimes you can fill some of that medical history and prescription information out and sometimes symptoms out ahead of your appointment through a portal, or sometimes they'll even mail you those papers ahead of time. So you don't have to be so stressed about filling that all out as soon as you get there. But if you have it all prepared in your binder, it should make it a little easier for you. And so to ensure the best management of your disease, it's essential to create a partnership with your healthcare team. And that really does include clear communication. Be sure to tell your physician about any changes in your symptoms. This can help during your evaluation and when ordering tests to ensure that your doctor has the best understanding of your current health. Be sure to tell the doctor everything that you're doing that could affect your health. Remember, your appointment is confidential. Are you taking any over the counter medications for a different condition, or are you on a diet? Do you have any stress at home? All of these things could impact your health, even if it's emotional stress. When you talk to your doctor, be as specific as you can about each symptom, when it occurred, and how it affected you. I apologize about my dogs in the background. And then the big piece of this is to not be embarrassed. Your doctor has heard it all. And so if you're planning on discussing a personal topic, one way to avoid nerves is to practice what you plan to say in advance. If you're comfortable enough, you could also kind of practice saying it to a close friend or family member, if that may help you to be able to say it to someone else out loud. So during your visit, it's also a good idea to bring paper and pen so that you can take notes during the appointment. You may also ask the doctor, nurse, or pharmacist to write down instructions for you or to provide you with printed information about your disease, medications, or treatments. This will allow you to review information after the visit in the calm of your own home. And you can also share these notes with friends, family, and caregivers to help you understand how they can best support you in managing and treating your condition or disease. Some doctor's visits may make you feel emotional, stressed, or even rushed, or maybe angry if you sat in the waiting room for too long. So it can be helpful to have a supportive family member, friend, or someone that you trust accompany you to appointments. They may also be able to help by taking notes or helping you recall what was said during the visit. Sometimes that person you take with you may have different answers for the physician or care provider than you do. They may remember that you experienced a symptom that you forgot about as well. I also want to share that it's really important to keep an open mind. If you go to a doctor's appointment with a fixed idea about what is wrong, you and your doctor may overlook a key aspect of what could be causing that problem. A lot of times people might be fixed on that they have lupus, and that's what they focus on. But truthfully, those symptoms mimic a lot of other diseases. So without an open mind, they may miss that those symptoms are being caused by another disease or condition. So the end of your appointment is just as important as the beginning. And so don't hesitate to let your doctor know about any questions or concerns you may have. I know sometimes we feel rushed, but it's best to be proactive in voicing your questions and concerns, as opposed to depending on your doctor to ask the right questions. So if you have any doubts about something the doctor has said, don't hesitate to continue asking questions until you feel satisfied with the answer or have a clear understanding of what is going on. Before leaving, you can ask your doctor some of the sample follow-up questions we have listed here. And those include, questions about, are there any additional tests that need done to help decide about a diagnosis? Are there any diagnoses that they can rule out? Are there any symptoms that you should be watching for? What can you do at this time to feel better? And so there's a lot of different questions, but making sure you have a clear picture about the information you were given and next steps moving forward. And before you leave, you should also ask if you can get a visit summary or a follow-up summary instructions that are written. So, a lot of times your doctor will go over what was discussed, decisions made about your treatment, if any, and suggested changes to your medications. But a lot of times, doctors are hurrying to stay on schedule, or they may already be behind schedule, and they may accidentally kind of forget to give you that summary or not fully explain what you need to know. So remind your doctor to give you that brief summary at the end of your appointment about what's been discussed. It may come from the nurse, depending on how their doctor's office works. But again, you want to make sure you get that good overview. You have a good understanding of where you're at in that appointment and where you're at with your condition. And then they should also be letting you know of any kind of follow up that you need to do now, including any new lab tests. And they should also tell you when you should have your next appointment. So while you're already at the doctor's appointment, make any follow-up appointments. That way it's already on the calendar. You won't forget to schedule it. And you also hopefully will get a little bit more say in when that appointment is, if it works better with your schedule. For instance, if it works better to have a morning or afternoon appointment, if your doctor is available during those times, hopefully you'll be able to fit in what you need to make it work the best for you. I also want to share that don't be afraid to advocate for yourself. And so self-advocacy, is really where you advocate for yourself. It enables your doctors to treat you effectively. And in order to give you the best care, your doctor needs as much information possible about what you're feeling and noticing in your body. Empower your family members, friends, trusted loved ones and healthcare providers to give you the support you need. Most people want to help, but they can only do so if you're clear about what you need. Ensure that all of your needs are being addressed. No one knows your body, your emotions, and your mental stresses as well as you do. That's why the best person to advocate for you is yourself. If you don't feel heard by your doctor, take a deep breath and politely and firmly insist that your symptoms are real and you would like a further evaluation or more diagnostic tests done. We have some resources available. They're not just lupus specific, just in general, and they include lessons from health advocates to improve your care experiences, your right to hurt and be heard, and getting the most from your medical appointments. A lot goes into preparing for doctor's appointments. It's not only important to prepare for your doctor's appointment, but be an active participant during and after your appointments so that you can get the care that you need. Every medical appointment is your opportunity to explain and discuss your problems and concerns with someone whose job it is to listen and help. And keep that in mind. It is your doctor's job to listen to you and to want to figure out what is causing your issues and provide treatment. The better prepared you are for that appointment, the better you'll feel about the experience, and the closer you'll be to receiving an accurate and timely diagnosis or better management of your condition. These are just some ways as I close out today that you can get more information or how you can reach out to us at the Lupus Foundation of America. It's also a great way to stay on top of different programs and different offerings we offer. So again, thank you for joining me today. I'm so thrilled to be here, and I'm going to go ahead and give this back to Carla.
Ashley, thank you so much for that very thorough presentation. We are always so excited to have you come and present because we know that you are going to have very thorough presentations and action steps and ways that everybody can really take the valuable information you suggest and incorporate them into their lives. So before I get to the very important questions segment portion, I first of all want to make sure that you can see my screen. Ashley, are you looking at my slide deck? It's just a gentleman with an inquisitive look looking up at the sky. Do you see that?
I do, but it is
Perfect.
small. It looks like there's some other slides there too. I don't know if you can just make them bigger.
I can do that. Let's see. I'm going to try and do that. Is it still the same?
It is.
How about now?
There we go.
Look at
Much
that.
better.
That wasn't that bad. Thanks for bringing it in there, everybody. So the reason this screen is up is because we want to encourage you, and I do see a lot of people already doing so, to submit any questions you may have, and you could do so by typing them into the chat section of your Zoom control panel. And as we get to those questions coming in, promise, I do want to leave up the contact information for the Lupus Foundation of America. And again, a huge thank you to my friend and colleague, Ashley, for taking time out of her schedule to share her expertise with the Needy Meds audience. One of the things I love so much about this presentation is because it is applicable, it truly is applicable to everyone. As you mentioned, Ashley, there are certainly pieces of wisdom throughout your presentation that can be incorporated into all parts of our life, like managing expectations and being prepared when we're able to. So we're going to go ahead and get to those questions. Before we do, though, again, the contact information for Lupus Foundation of America is on your screen. Their website is lupus.org. Their phone number is 202-349-1155. And importantly, you can, and you'll see this on your screen, reach out to their expert health educators at lupus.org/health educator. In the bottom of the screen, you'll see the Needy Meds website, needymeds.org, our toll-free helpline, 1-800-503-6897. And right in the middle is my work email, Carla with a C at needymeds.org. A couple of suggested action steps I'd like to mention. First of all, I shared that today's presentation will be uploaded onto the Needy Meds YouTube channel. The reason I stress that and suggest subscribing is because a lot of times, like what Ashley talked about today, there's so much information that is valuable. We want to make sure that you're able to revisit the entire webinar or parts of it so that you can put these steps into action in your life. So we upload it so that certainly you can rewatch it. We upload it because a lot of us out there, like me, we sometimes sign up for webinars and we have every intention of being there, but then life gets in the way. So we want to make sure when you sign up for webinars that you don't ever miss out if you're unable to join us for the live presentation. And also because then you can share this webinar with relatives, family, friends, loved ones, patients, or clients moving forward. And so that's one of the first action steps. I also hope you guys check out needymeds.org because an obstacle, of course, we know in taking care of ourselves is making sure we have access to affordable medication and other healthcare needs. And that's what we're here for. But on the Needy Meds website, you'll also find a couple of other resources I think would be particularly helpful in light of today's make the most of your medical appointment presentation. First of all, Ashley talked a lot about the importance of keeping track of your symptoms. We do have a partnership with MyLinks, and you'll find information about MyLinks on the needymeds.org website. It is a free app that you can download where you can keep track of all of your medical records in one location. It makes it easier to look back and share it with your doctors and see what your symptoms have been and your other medical records are. Have it all in one safe, secure location that you have control of. Also, on our homepage, you will find a link and information about BeMedWise, or you can go directly to bemedwise.org. That's a Needy Meds website and initiative with a mission of promoting the safe use, storage, and disposal of meds for better health. It's chock full of information about that, but it also has a ton of really helpful information about how to be an educated healthcare consumer, how to prepare for doctor's visits, how to keep track of your symptoms, and how to step up if you are required or want to be a caregiver for somebody you love. So check that out. I also can't stress enough to go to lupus.org. You will find a ton of information, of course, not only about that diagnosis, but much like today's presentation, a lot of information that is not lupus specific. And of course, we encourage everybody to follow Lupus Foundation of America and MediMeds on social media. And please join us for future webinars. So that contact information, as I mentioned, is going to remain up on that screen while we get to some of the questions that were asked during Ashley's presentation. So Ashley, one of the first questions that came in, and I think this is something, unfortunately, we can all relate to, is this: my provider is always in a rush during my appointment. How can I get him or her to listen to my concerns? And, I really wish I couldn't relate to that at all, but unfortunately, I think that's a really common concern and problem that we all face. So what can you tell us about that?
Right. And I think sometimes we get in a rush as a patient because we've waited so long in the waiting room and we might have other commitments, right?
Right.
But outside of that, it goes back to when you're scheduling that appointment and being really clear when you call to schedule it, because different types of visits have an assigned amount of time for the provider per patient. So making sure that we're clearly communicating our needs, they can schedule you for a longer appointment time. So like I said, every office is different, but annual appointments are typically longer than regular checkups, and problem visits may be slotted for, a different amount of time too, depending. So if we want to make sure that we are saying what kind of appointment it is, and that way they can judge how to schedule it and maybe give you a little bit more time on the schedule. You could also ask if your doctor does any type of consultations in their office outside of the exam room, especially if you have a long list of topics to discuss. That way, you're not feeling as rushed in that exam room, and it may afford you a little bit more time with that care provider, hopefully, so that you're not feeling quite as rushed.
That is so helpful. It never even occurred to me to even advocate for myself or be more communicative when I schedule the appointment. So simply letting them know I might need more time never even crossed my mind. Thank you for the question. Thanks for the great tips, Ashley. So you did mention getting second opinions, I believe, throughout your presentation. How does a patient decide? This is a question that also came in, and it was phrased like this: when should I get a second opinion?
So, I kind of mentioned this at the end with I believe it was the advocating or shortly thereafter, your doctor
That's
works for
right.
you. So, but only you can decide if you should get a second opinion. But a common reason would be if you feel like your doctor is not listening to you or not taking your concerns seriously. I think that is more than a more at the gosh, I'm tongue tied. That is a great reason to seek a second opinion. If you don't feel like your doctor's taking you seriously or your condition seriously, seek a second opinion if you feel like there's definitely something going on. um, Another reason would be if you're having trouble talking to your doctor and being open and honest with them, especially if you're not feeling comfortable discussing sensitive topics. That's not really a great relationship there where you feel like you can freely share what's going on. Oh, excuse me. And then if your doctor's not a specialist for your condition, so if you're diagnosed with something, you'll want to get a second opinion from a specialist that specializes in that condition. You also may want to get a second opinion if you want to explore if there are other treatment options that your doctor has not provided. So again, that's why being proactive is so important. If you're doing your research, you may know that your doctor is not offering every treatment out there, and maybe they can't give you a good reason why that's not a treatment option for you. And then another reason would be if the treatment recommended is risky. So if it involves surgery or it could have lifelong consequences, you definitely want to make sure that you're seeking out a second opinion. If you can, I know some surgeries are very time sensitive and you may not be able to get that second opinion, but if you're able to, consider seeing if another specialist would also recommend that surgery.
Such great advice. And I really, at one of the tips you mentioned throughout your presentation in the very beginning was manage expectations. And as you're speaking, I'm realizing that that is really important in everything you're talking about. For example, this question about when should I get a second opinion, I think managing your expectation uh, prior to even that first doctor's appointments. I know I'm guilty of this. I think I'm going to have a one and done doctor's appointment where all of my, oh, let me back up and put that contact information up there, where all of my answers are going to be met thoroughly handled in that initial visit. So I think managing expectations with knowing that this might be just the beginning, the first step in a process. So that's really important. Thanks for that, Ashley. So another question coming in, and this is also super important. Again, something super relatable. How can I get the names of my previous doctors so I can get my medical records? I've seen so many doctors over the years, I forget their names. Yes, very relatable. And oftentimes important to gather those records. Do you have advice for how we could go about that, Ashley?
Right. So I know I'm guilty of this. And it was mostly when I was younger, right? I didn't think about the orthopedic doctor I saw when I was in high school. And I don't think that my parents remember their name. So, sometimes it's difficult to gather all of that information. And this really goes back to why it's so important to keep copies or records of your medical history, or at least keep that running list in somewhere, whether it's in an app or in a binder or folder, moving forward. Now, as far as previous ones, if you can remember who you've had health insurance with, so like the carrier, the name that would be on your insurance card, you can try calling their customer service line and asking for copies of your EOBs, your explanation of benefits. Those EOBs would have providers' names, but the catch is I don't know how far those providers would be able to provide those for you. Sometimes it's helpful to jog your memory if you know the location of where that provider was. You might be able to look up the practice and see the names if they're still there. But unfortunately, there's not a great way to get previous names if it was quite some time ago. If it was 10, 15 years ago, it might be difficult. But again, like I said, it just really kind of demonstrates the importance of tracking moving forward and tracking up into the point where you can remember in the past, right? Like start documenting that before, that's replaced by other names in your mind.
Thank you so much, Ashley. And thank you to our audience for these really important questions that I think are applicable to so many of us. As I said, we do try and keep the question segment brief. So I'm going to wrap it up with just one more question while we still have you, Ashley. But again, you could ask a question that we're not getting the chance to answer. Don't hesitate to reach out to the Lupus Foundation of America. The contact information is on your screen. Or, of course, Needy Meds, and the contact information for our website and toll-free helpline is at the bottom of that screen. So wrapping up with this question, another important one. Do you have any recommendations, Ashley, if I'm unable to bring someone with me to my appointment?
Sure. Yeah. So there's a couple of things. And I know a lot of providers' offices are different, but one would be to ask if you have a cell phone and it has the capability, if you could use your phone to record the info that's given to you, like the audio of the conversation. But again, you would want to ask permission. You can ask if a nurse is available, or somebody, a staff member in the office, if they're available to maybe take notes for you. And again, it goes back to asking if there's also a printed summary that they can give you at the end of the appointment. A lot of providers' offices now use online portals as well. And so you can ask if they could upload any information to that portal that you could then look at later with a loved one. You can also ask not just for that follow-up summary, but if they have any other printed materials or anything that they can print out for you in relation to what you have going on. It's a little bit easier to print materials if it's a condition or a disease, something like that, but they may be able to give you that as well. But those are some good options. Like I said, it's very dependent upon the office, but hopefully you can either record the conversation or they'll have someone available to take notes for you, or they'll be able to provide those notes for you through that portal later on so that you can access them later.
Thank you again, Ashley, for the thorough response. And thank you to everybody that took time out of their day to join us to learn a little bit more about the Lupus Foundation of America, about Needy Meds, and most importantly, how to make the most of your upcoming medical appointments. We do encourage you to, as I said, check out this video, find it once we upload it to the Needy Meds YouTube channel so that you can use it as a resource. You can revisit it so that you can review all of these steps that Ashley provided, and so that you can share it with people in your life, whether it be loved ones or even patients. Um, Again, that all of our contact information is on the screen. So we do look forward to seeing your names pop up in future webinars. With that, thanks again, everybody. And thank you, Ashley, for taking time out of your busy schedule to help us learn more about how to make the most of our medical appointments. Thanks, everybody. Have a wonderful rest of the day. Take care.